you have to have a gene for addiction. You have to have a gene for addiction. It's just the way our genetics work as far as we know. In order for you to get lung cancer, for example, you have to have a gene for it somewhere. It could mutate over time, or you could be born with it. But if you don't have one, you could smoke 8 packs of cigarettes a day, every day for like your whole life, and you're not going to get lung cancer. You're going to smell bad, and you're probably going to get emphysema, and you're not going to be able to breathe. But you won't get lung cancer, right? So you have to have a gene. So 60% of the whole population has at least one gene for addiction. Some people have more than one gene. Genes have to be triggered. They have to be turned on. So when we're developing babies and we have a gene for blue eyes and a gene for brown eyes, the hormones that are fluctuating and making us develop as little fetuses have to trigger the gene that's going to actually show and express itself, which is the color of our eyes. So the gene for addiction has to be expressed, and that can be turned on by trauma, by environment, and by experience, so continued use of substances. And once the gene is turned on, then you have true addiction. That's where the disease of addiction truly occurs, when the gene is turned on. Because when the gene is turned on, that is when the dopamine receptors start going away, and you start needing higher levels of dopamine just to feel normal. So here's an example that I like to use all the time to help people sort of understand what I'm saying. There's a guy who drinks alcohol every single day for like 10 years and drinks a lot. And maybe his life is kind of crappy because of his drinking, but it's not, it's not enough that he goes to rehab. He just decides one day, I'm done. And he puts down the drink and says, I'm not drinking anymore. And he goes and gets a job and meets somebody and gets married, and they have kids, and he's got this great life, right? So for 8-9 years, he has not had any alcohol or drugs. He's just living his best life. And he's an upstanding member of society, and he's doing great. And he talks all the time about how he was an alcoholic, but he just stopped drinking. Well, he goes on a skiing trip with his family because he's good like that, and he injures his knee, and he winds up getting surgery, and the doctor gives him prescription for oxycodone. Unbeknownst to him, he does have a gene for addiction. However, his gene is not triggered by alcohol. His gene was triggered by opiates. So he's taking these oxycodone for a few days, and initially his pain level's here, and so the amount of meds he's getting kind of matches that. So he's just getting some pain relief, right? But after a day or two, the swelling goes down, the body starts to heal, the pain level starts to decrease, but the amount of medicine that he's getting is the same. So that little fragment in between, that difference, right, that's where he starts to experience some euphoria. And he says, oh, yeah, this is good, right? My anxiety is better. I feel a little bit, maybe I'm gonna go clean out the garage even though my knee's bad. My kids think I'm funnier. Good things start happening. So he starts calling the doctor, give me more, give me more. He's an upstanding member of society. He's a good dude. He golfs with his doctor on the weekends. So his doctor says, all right, yeah, I'll give you some more. And eventually we all know the story, right? He takes too many, doctor cuts him off, asks his buddies, they run out of their extra stash. Now he's on the street looking for some. It's too expensive. He goes to heroin. Now he's shooting heroin, and he winds up in detox. And I have him as a patient, and I say, well, I'm going to detox you off this opiate, but my recommendation is that you don't use any other substance once you get out of here. You really focus on staying abstinent because I'm worried about your brain. And he says, oh, Dr. Laber, you're really nice and you seem smart, but I know me. I know me. And I don't have a problem with alcohol because I used it every day for 10 years and I put it down. It was not a problem. And I say, okay, man, do you. And a year later, he's back on detox. And I'm detoxing him off of both alcohol and opiates. And because what happened was when he was drinking alcohol, he never triggered that gene. So his threshold for pleasure never went beyond normal. So he was just getting these spikes of the dopamine from the alcohol, but it never changed anything neurobiologically. However, once he started taking the opiates and hit that certain threshold that the gene triggered and expressed, the addictive genes triggered, then the dopamine receptors start going away. Well, now that the dopamine receptors are going away, alcohol is now going to give relief to that part of the brain, right? Because alcohol releases high-level dopamine. Cocaine would also do it, methamphetamine, benzodiazepine, certain sleep medications, right? There's a lot of things that release high-level dopamine. Even though this gentleman may claim he doesn't like any of them, his brain would find relief from the use of any of them. And so then the brain would come to depend on that substance, whatever it is. And so I often say to people, the problem isn't necessarily that now you're, using marijuana, okay? Because we know that's probably the least dangerous of all the addictive drugs and it doesn't have a ton of consequences. But if you have addiction and you're using marijuana, what happens is your brain now believes that high level dopamine it gets from the marijuana is necessary to deal with life, right? That's the only way it feels normal. And so if you need to smoke marijuana to deal with a stressful Tuesday at work, the brain doesn't have any other coping skill except to reach for high level dopamine when your mom dies or your dog dies or something really traumatic happens. And so that marijuana is not going to cut it anymore. And the brain's going to reach for something stronger. And that's where we start to see the problems. And so people could successfully use something like marijuana or even a prescription medication for a number of months or even years before that would happen. But the concern is that the brain doesn't have the opportunity to properly heal and develop new coping skills, right?